Death is a universal experience, an inevitable part of our journey through life. It is a destination we all share, regardless of our paths. Just as birth is a natural part of life, so is death. Understanding the biological and physiological changes that occur can help us approach it with a sense of peace. Discussing death can be challenging, but knowledge about the process can provide comfort and clarity. Let's explore the detailed scientific aspects of dying. As the body approaches death, it undergoes several physiological changes. These changes can be categorized into pre-active and active phases of dying. In the pre-active phase, which can last weeks to months, the body starts to shut down. Appetite decreases, and there may be increased sleep and withdrawal from social interactions. The active phase of dying, typically lasting days to weeks, involves more pronounced changes. Breathing patterns may become irregular, and there can be periods of apnea. Circulation slows, leading to mottled skin and cool extremities. The body's metabolism decreases and organ systems begin to fail. These physiological changes are part of the natural cycle of life and death. Each person's experience is unique, influenced by their health, environment, and personal journey. The information presented here is intended to be educational and should not be interpreted as medical advice. For personalized guidance and support, consult with healthcare professionals who can offer specific advice tailored to individual needs and circumstances. As the body begins to shut down, cellular activity starts to decrease significantly. Mitochondria, the powerhouses of the cells, produce less energy, leading to increased fatigue and a desire to rest. Oxygen levels in the blood drop, causing slower and more labored breathing. The digestive system slows down, reducing appetite and thirst as the body conserves energy. This energy conservation is a natural response as the body prioritizes essential functions. It's crucial to respect their wishes and not force them to eat or drink if they don't want to. Social withdrawal occurs as the brain's activity diminishes, leading to less interaction with the environment. This detachment from the physical world is a normal part of the dying process as the body and mind prepare for the end. At the moment of death, the heart stops beating and breathing ceases. This cessation of vital functions triggers a cascade of biological events. The brain, which controls all bodily functions, also stops working. Neurons cease firing and brain activity flatlines. This marks the end of a person's physical existence. Cells begin to lose their structure and function due to the lack of oxygen. The eyes may remain open or closed, and the pupils, the black centers of the eyes, become fixed and dilated, meaning they get bigger. This is due to the loss of muscle control. There is no response to light or touch, and reflexes are absent. The body enters a state of rigor mortis, where muscles stiffen temporarily. Section 4. Physical changes after death, the body's final chapter. After death, the body undergoes a series of intricate physical changes. These changes are part of the natural process of decomposition and occur in a predictable sequence. Initially, the muscles relax, leading to the release of bowel or bladder contents due to the loss of muscle tone. This is a common occurrence and marks the beginning of the body's transition. This release is a natural part of the process and is simply the body's way of letting go. The body temperature gradually drops to match the surrounding environment, a process known as algor mortis. This cooling can help forensic scientists estimate the time of death. Blood, no longer being circulated, settles in the lower parts of the body due to gravity. This process, called livor mortis, causes a purplish-red discoloration of the skin. The discoloration is often seen in the areas closest to the ground and provides clues about the body's position after death. Rigor mortis, the stiffening of the muscles, sets in a few hours after death. This stiffness starts in the smaller muscles, such as those in the face and neck, and then spreads to the limbs. The process of rigor mortis can take up to 12 hours to complete and is a key indicator in forensic investigations. After a few days, the body will loosen again as tissues break down. This marks the beginning of the final stages of decomposition, where the body returns to the earth, completing the cycle of life and death. Section 5. Navigating pain and finding comfort in hospice care. Pain management is a critical aspect of hospice care, addressing both physical and emotional discomfort. The intensity of pain can vary widely based on the underlying illness, such as cancer, heart disease, or neurological conditions. Each individual's pain experience is unique, influenced by factors like disease progression, psychological state, and personal pain tolerance. Hospice care employs a range of medical interventions to manage pain, including medications like opioids, non-opioid analgesics, and adjuvant therapies. The hospice team, comprising doctors, nurses, and pharmacists, collaborates to tailor pain management plans to each patient's needs. Palliative care also includes non-pharmacological approaches such as physical therapy, massage, and relaxation techniques to enhance comfort and quality of life. Emotional and spiritual support is integral, with social workers and chaplains available to help patients and families navigate the emotional complexities of end-of-life care. Section 6. Embracing life and death. A conversation for everyone. Death is an inevitable part of the human experience, and understanding it from a scientific perspective can help demystify the process. Biologically, death occurs when the body's systems cease to function, leading to the cessation of vital processes. This natural progression is a part of the life cycle shared by all living organisms. Societally, discussing death openly can reduce the stigma and fear associated with it. Cultures around the world have different rituals and beliefs about death, which shape how individuals perceive and cope with it. By engaging in these conversations, we can learn from each other and foster a more accepting attitude towards the end of life. Psychologically, acknowledging death can lead to a greater appreciation for life. It encourages us to reflect on our values, relationships, and what truly matters. Support systems like hospice care and grief counseling play a crucial role in providing emotional and psychological support during this time, helping individuals and families navigate their feelings and find comfort. Support groups offer a communal space where individuals can share their experiences and emotions. These groups are essential for providing psychological support, reducing feelings of isolation, and fostering a sense of community. They help individuals process their grief and find solace in shared experiences. Embracing the reality of death can lead to a more meaningful and fulfilling life. By celebrating our moments and cherishing our connections, we can live with a greater sense of purpose. Understanding the scientific, societal, and psychological aspects of death allows us to approach it with a balanced perspective. By facing the reality of death with courage and compassion, we can support each other through life's highs and lows. Open conversations about death can strengthen our connections and help us build a society that embraces both life and death with understanding and empathy. If you found this video insightful, please like and subscribe to our channel for more content on life's important conversations. Thank you for watching.